Hello all, welcome to my channel Weight Lecture. Today we will discuss multiple choice questions on veterinary pharmacology. Question number first. The very purpose of metabolism of drug in the body is to render them options A. Functionally inactive, options B. Water soluble, option C. Lipid soluble, or options D. Neutral compound. The right answer is option B, that is water soluble. Actually, that drug metabolism is as one of that pharmacokinetic process where that the conversion of that lipid soluble form and that non-polar form to that water soluble and polar form. Okay, so that drugs are easily excreted out from that body. And this metabolism's process mainly involve two phase. That's phase one's mainly involve that functionalization reactions where that the parent drugs compound is converted into that more polar form by introducing or unmasking that functional group like hydroxylase groups, amine groups, and thiols groups. While second phase reactions involve that conjugations process where that polar conjugates are added to that parent compound like a glucuronic acids conjugations, sulfate conjugations, glycines, and other amino acids, as well as glutathiones, acetylations, or methylations take place. Okay. Questions number second, a more gradual decrease in response to drugs taking days or weeks to develop is called options A, drug resistance, options B, tachyphylaxis, option C, desensitization, or options D, tolerance. The right answer is options D, that is tolerance. Okay. When there is a gradual decrease in response to drugs, that is known as tolerance. While when there is a sudden decrease in response to any drugs, then it is referred by term tachyphylaxis. Okay. While drug resistant is that actually referred to that ability of the disease causing germs where they can survive and continues to divide despite the presence of the drugs that can usually kill them. Okay. And while drug desensitization is a process uh, where we temporarily uh, induce the tolerance to the sensitized drugs by administrating that at first that low amount of drugs and then starting and then increasing gradually to the full therapeutic dose. It is mainly used for those patients where there is a drug hypersensitivity presence and we have no other options available to that drugs. Okay. Questions number three. The anti-inflammatory effect to the of the meloxicam is due to its ability to inhibit options A, preferentially COX-1, options B, preferentially COX-2, options C, COX-1 and COX-2 equipotentially, or options D, lipooxygenase. The right answer is options that is B, preferentially COX-2. Okay. The anti-inflammatory effect of meloxicam is due to its ability to inhibit that COX-2 preferentially. Okay, here are some examples that preferentially COX-1 inhibitors are that ketoprofen, indomethacin, aspirin, maclophenamate. Okay, while preferentially COX-2 inhibitors are diclofenac, celecoxibs, meloxicams, itoricozib. Okay, while non-selective that COX inhibitors, that's ibuprofens, sodium salicylate extra. Since lipoxygenase is that enzymes which is play a vital role in conversion of arachidonic acids into leukotrienes, which is actually the mediator of inflammations. And here's an example of lipoxygenase inhibitors, that is a Giluton, Zyflo, film tap, Zidflo CR extra. Questions number four. The time lag for the drug to fall one half of the original concentrations in plasma is called options A, bioavailability of drug, options B, durations of actions, option C, half-life, options D, clearance. The right answer is option C, that is a half-life. Okay. The time lag for the drug to fall one half of this original concentration in plasma is called half-life of the drugs, while bioavailability is the terms which is given to that amount of that active drugs that actually reach into circulations from that absorption site. Okay, while clearance refer to that removal of drugs from that plasma, and elimination refer to that removal of the drugs from the body. Okay. Questions number 5. The bactericidal action of cephalosporin group of antibiotics involve inhibitions of options A, cell wall synthesis, options B, DNA replication, option C, ion transport, options D, protein synthesis. The right answer is option A, that is a cell wall synthesis. Okay. Here are some example of that bactericidal drugs. I have a mnemonics that's penicillin and cephalosporins are very bactericidals for microorganisms, where P stands for penicillins. Okay, C cephalosporins, R, that A for R stands for aminoglycosides, very V stands for vancomycins, and the bactericidals, because these all our drugs are bactericidals, so bactericidals, F for F, that is a fluoroquinone, and microorganisms, M stand for metronidazoles. Okay. uh, Bacteriostatis bacteriostatics antibiotics are like chloramphenicol, clindamycin, erythromycin, sulfamethoxazole, tetracycline, trimethoprim, extra. Okay. And if we see that's mechanism, then penicillin and cephalosporins, vancomycins actually inhibit cell wall synthesis, while aminoglycosides inhibits protein synthesis. Fluoroquinone mainly inhibit DNA synthesis. Metronidazoles uh, uh, also did that fragmentation of DNA, while sulfonamide inhibit folic acid synthesis. It's actually the structural analogous of that PABA, that's para aminobenzoic acids. Okay. And clindamycins mainly inhibit protein synthesis by binding to 50S ribosomal subunit. Chloramphenicals also inhibit protein synthesis by binding to 50S subunit. Okay. Tetracyclines actually inhibit protein synthesis by binding to the 30S ribosomal subunit. Questions number 6. Arthropathy is one of the major side effects observed with options A, sulfonamide, options B, fluoroquinine, option C, macrolide, options D, smooth endoplasmic reticulum. The right answer is options B, that is a fluoroquinone. Okay. If we see that side effect of some antibiotics, then orthopathy is mainly observed with fluoroquinolone, while in case of sulfonamide, we found that hypersensitivity reactions, kernicterus, bone marrow depressions, crystalluria, hemolytic aplastic anemia. Okay. Similarly, in case of aminoglycosides, that nephrotoxicity and ototoxicities were observed. Okay. In case of tetracycline, that's gastrointestinal tract toxicity, photosensitivity reactions, liver damage, dentitions and bone damage. And in case where we given expired tetracycline drugs, then we can see that Falcone syndromes. Questions number 7. The receptors for steroidal hormones are located in options A, plasma membrane, options B, cytoplasm, option C, mitochondria, options D, smooth endoplasmic reticulum. The right answer is option B, that is the cytoplasm. The receptor for steroidal hormones are actually found in cytoplasm of cells, while receptors that acts on DNA and RNA are actually found in nucleus, while receptors that acts on glycoproteins mainly found in cell wall. Questions number 8. Previously identified endothelium derived relaxing factor is currently known as options A, endothelin, options B, platelet activating factor, option C, nitric oxide, options D, eicosanoids. The right answer is options C, that is nitric oxide. Okay. Previously identified endothelium derived relaxing factors is currently known as nitric oxides. Okay. Let's see some fact related to nitric oxides. Then, right, nitric oxides mainly reduces the oxidation of low density lipoprotein cholesterols, which is a major component of plaque. Okay. And it's also dilate blood vessels too. It reduces platelet stiffness, reduces release of superoxides radicals too, and it's the least potent inhalant anesthetics, and it has a second gas effect. Okay. Questions number 9. Acetylcholine esterase enzyme is relatively rich in the venom of options A, Russell's vipers, options B, cobra, option C, common critters, options D, pit viper. The right answer is option B, that is cobra. Acetylcholine esterase enzymes which mainly break down that acetylcholine. Okay, it's mainly rich in the venom of a cobra. Okay, while Russell's vipers venoms mainly contain two well-known proteinases. That is one is that serine proteinases, which is known as Russell's viper venom factor V activator. Another proteinases, that is a metalloproteinases, which is known as Russell's viper venom coagulation factor X activating enzymes. Okay, if we see that's common creates venoms, it's mainly contain beta bungarotoxin, which are presynaptic neurotoxin, which with phospholipase A2 activity and is considered to be the major cause of paralysis. Okay, similarly, if we see that's venom of pit viper, then it's mainly contain that mix of toxins which mainly include metalloproteinases that cause local tissue destructions, and also there is like thrombin like protein which mainly cause coagulopathy. Okay, questions number 10. The tox albumin presence in the castor bean is options A mimosin, options B strychnine, options C ricin, options D hyoscine. The right answer is option C, that is ricin. Okay, the tox albumin, which is present in a castor bean, that is ricin. Okay, while the toxin mimosin actually presents in a large quantity in a leaf, spores, and seed of tropical legumes of the genus Leucaena, and also that plant Mimosa pudica. Similarly, strychnine is a toxin alkaloid, which is mainly presents in that the seeds of that tree Trichinus nux vomica. Okay, while hyoscine, which is another name of hyoscine, is that scopolamine, which is also that alkaloid drugs, and it's obtained from that plant of family Solanaceae, like nightshade, henbane, and Jimson weed. Okay. Questions number 11. The principal and ubiquitous excitatory amino acid neurotransmitter presence in the CNS is options A L-glutamate, options B GABA, option C D-serine, options D glycine. The right answer is option A, that is the L-glutamate. Okay, the excitatory amino acids neurotransmitter which is present in the CNS is L-glutamate, while inhibitory neurotransmitters which is present in CNS are that GABA and glycine. Questions number 12. A non-steroidal compound with anti-estrogenic effect is options A finasteride, options B tamoxifen citrate, option C diethyl stilbestrol, options D flutamide. The right answer is option A, that is the right answer is option B, that is tamoxifen citrate. Okay, a non-steroidal compound with anti-estrogenic effect is tamoxifen citrate. Okay, this tamoxifen citrate is actually used to treat that certain type of breast cancer in case of a man and women, while that flutamide is also that non-steroidal compounds, but it is androgenic property. It's mainly competitively bind with that androgen receptors, which is present throughout the body. Okay, similarly, finasteride, which is anti-androgenic hormones, it is mainly used in the treatment of that prostate hyperplasia, is used to shrink that enlarged prostate gland by stopping that testosterone turning into that another hormones called dihydrotestosterone. Okay, similarly, diethyl stilbesterols is a synthetic form of that estrogens. It's mainly used to prevent that miscarriage, and also given when there is a complications regarding of a pregnancy. Okay, questions number 13. One among the following is the most potent reactive oxygen species. Options A H2O2, options B O, option C OH groups, options D NO. The right answer is options C, that is a hydroxyl group. Okay, if we see that the most reactive oxygen species, then we found that superoxide is most reactive, followed by that hydroxyl, then peroxyl, then alkoxyl, and then hydroperoxyls. And if we see that's most reactive nitrogen species, then nitric oxide is more reactive as comparison to nitrogen dioxide. Questions number 14. Ionophore with anticoccidial activity. Options A, selinomycin. Options B, nicarbazine, option C, amprolium, options D, none. The right answer is options A, that is a selenomycin. Okay. Ionophore with that anticoccidial property, that is a selenomycin, while nicarbazine is mainly contain that equimolar complex of 4,4-dinitrocarbamylide and 2-hydroxyl 4,6-dimethyl pyrimidine. It also that antioxidants, it has also that antioxidant property. Similarly, amprolium is actually, it also coccidiostatin drugs. It's a thymine analogous, and it's block the thymine transporter of Eimeria species. Questions number 15. Effective against all three type of helminth parasites. Options A, albendazole. Options B, closental. Option C, netobimine. Options D, all. The right answer is options D, that is all. Albendazole, closentals, and natobimine all are effective against all three type of helminth parasites, that's trematodes, cestodes, and nematodes. But if we see that's drug of choice for that trematodes, that is flatworm, then we find that triclabendazole. The dose rate of triclabendazole is 12 mg per kg body weight, followed by oxyclosanide, that's 10 to 15 mg per kg body weight. If we see the drug of choice for tapeworm, then praziquantel is the best drug of choice for tapeworm. The dose of praziquantel is 10 to 15 mg per kg body weight, followed by niclosamide, the 75 to 100 mg per kg body weight. If we see the drug of choice for roundworm, then piperazine. The dose of piperazine is 200 mg per kg body weight, followed by levamisole, whereas the dose of levamisole is 7.5 mg per kg body weight. Questions number 16. Act as babycidals and trypanocidals. Options A, proguanid. Options B, pentamidine. Option C, diminagine. Options D, none. The right answer is option C, that is a diminagine. Okay. Drug that act as both, that's babycidals and trypanocidals, that is diminagine. Okay. And if we see that's a drug of choice for thaleria, then it is buparvacune, and drug of choice for anaplasma, that is a doxycycline. Questions number 17 is an oxidizing disinfectant. Options A, potassium permanganate. Options B, boric acid. Option C, hydrogen peroxides. Options D, none. The right answer is options A, that is potassium permanganate. Okay. Here's some example of oxidizing disinfectants like halogens, chlorine, iodine, bromine, chlorine, dioxides, and peracetic acids and hydrogen peroxides. While similarly, that example of reducing disinfectants like formaldehyde, glutaraldehyde, extra. Questions number 18. Pyrental has options A, choline mimetic action, options B, GABA mimetic actions, option C, fumarate reductase inhibitions, options D, succinic acid inhibitions of parasites. The right answer is options A, that is a choline mimetic actions. Parental PAMOD has choline mimetic actions. It's act as a depolarizing neuromuscular blocking agents. Thereby, it cause sudden contractions followed by that paralysis of that helminth. Questions number 19. Cefotaxime is option C, first generation cephalosporin. Options B, second generation cephalosporin. Option C, third generation cephalosporin. Or options D, primitive cephalosporin. The right answer is option C, that is third generation cephalosporin. Let's see some example of that cephalosporin. Then first generation cephalosporins mainly includes cefazolin, cefalothene, cephaloridine, cefadrosil, cefalexine, cefaradrine. Okay, while the example of second generation cephalosporins mainly includes cefoxitin, cefprozil, cefotitan, cefmetazole, cefaclor, cefuroxime. Okay, while third generation cephalosporin may include cefazime, ceftazidime, cefotaxime, ceftizoxime, cefpodoxime, ceftriaxone. Okay, cefoperazone, ceftibutane, cefdinir, and mozaglactam. Okay, while fourth generation cephalosporin may include cefepime and cefpirol. Fifth generation cephalosporin may include ceftibiprole and ceftaroline. Okay. Questions number 20. Penicillin not degraded by beta lactamase enzymes are options A, monobactam, options B, phenoxymethylpenicillin, option C, ampicillin, options D, amoxicillin. The right answer is options A, that is a monobactam. Okay, monobactams are the class of that beta-lactam antibiotics with a broad spectrum of antibacterial activity, and uh, and have an structures which render them highly resistant to that beta-lactamase enzymes. Okay, let's see the classification of a penicillin. Then on the basis of source, there's two type of penicillin, that is natural penicillin and semi-synthetic penicillin. Natural penicillin mainly include that penicillin G and penicillin V, while semi-synthetics mainly includes cloxacillin, dicloxacillin, methicillin, naphthalene, oxacillin. Okay, if we see that on the basis of route of administration, then oral, that is penicillin V, amoxicillin, ampicillin, oxacillin, and parenteral, that penicillin G. Okay, and the methicillin, naphthalene, carboncillin, and piperacillin. Okay, on the basis of spectrum of activity, then narrow spectral penicillin mainly include methicillin, oxacillin, naphthalene, dicloxacillin. Okay, while broad spectrums mainly include amoxicillin, ampicillin. Intermediate spectrums may include penicillin V and penicillin G. Extended spectrum may include carboncillin and piperacillin. Okay, on the basis of resistance to beta lactamase enzyme, then resistance to enzymes may include methicillin, naphthalene, oxacillin, dicloxacillin, cloxacillin, while non-resistance to that beta lactamase enzymes may include penicillin G, penicillin V, amoxicillin, ampicillin, carbamazepine, etc. On the basis of resistance to acid, then acid stables penicillins may include penicillin V, amoxicillin, ampicillin, oxacillin, dicloxacillin, cloxacillin, while acid unstable penicillins may include penicillin G, methicillin, naphthalene, carboncillin, piperacillins, and ticarcillin. Okay. Questions number 21st. Sulfonamide, which is used in acute urinary tract infections. Options A, sulfamethoxypyridosine. Options B, sulfafurazole. Option C, thiol sulfathazole. Options D, sulfamethoxazole. The right answer is option that is B, sulfafurazole. Sulfonamide, which is mainly used in acute urinary tract infection, that is sulfafurazole. Questions number 22. Rifampicins act by options A, inhibiting cell wall synthesis, options B, inhibiting RNA synthesis, option C, inhibiting transfer of amino acids, or options D, none. The right answer is options B, that is inhibiting RNA synthesis. Okay, rifampicins actually act by inhibiting RNA synthesis. Rifampicins actually inhibit DNA dependent RNA polymerase enzymes, which lead to that inhibitions of RNA synthesis. Questions number 23. Which one of the following is purine antagonist? Options A, azathioprine. Options B, fluorouracil. Option C, vincristine. Options D, methotrexate. The right answer is options A, that is azathioprine. Azathioprine is that immunosuppressive agents that actually act through its effect as an antagonist of purine metabolisms, resulting in that inhibition of DNA, RNA, and protein synthesis. Similarly, fluorouracils is actually the part of chemotherapeutic drugs, that anti-metabolites. It's stop the cancer cells growth by stopping them making and repairing DNA. Okay, vincristine is that anti-tumor drug. It inhibits the formation of microtubules, formations of mitotic spindle, resulting in the arrest of dividing cells at their metaphase stage. Okay, methotrexate is actually that folate antagonist, results in the deficiency in the cellular pole of thymidylate and purine, and thus in a decrease in nucleic acid synthesis. Okay. Questions number 24. Alkali disease occur due to options A, copper poisoning, options B, selenium poisoning, option C, selenium deficiency, options D, poisoning due to alkali. The right answer is options B, that is a selenium poisoning. Okay, alkali disease occur in due to that selenium poisoning. Okay, let's see some that typical sign regarding to that certain poisoning. Then we found that garlic odor of GI tract content in case of phosphorus poisoning, deep green colored of feces in case of copper poisoning, hepatotoxicity and photosensitization reaction in case of lantana toxicity, bright red unclotted venous blood in case of cyanide poisoning. Okay, basophilic stippling is observed in case of lead poisoning, while chocolate brown colored blood found in case of postmortem in case of nitrate poisoning. Questions number 25. Absorbed mercury is stored in body in option C brain and spinal cord, options B lungs and brain, option C liver, option D muscles. The right answer is option A, that is brain and spinal cord. Okay. Absorbed mercury is stored in body in brain and spinal cord. Okay. Note there is no any antidote for mercury toxicity, while arsenic mainly stored in keratinized part of that body like hair, nails, etc. Let's see some antidote regarding to that metal toxicity. Then antidote of arsenic toxicity is bal or dimercaprol or sodium thiosulfate. While in case of that copper toxicity, that's ammonium molybdate or sodium sulfate. In case of lead, that is a calcium disodium EDTA. Molybdenum, that's copper sulfate. Nitrate and nitrite, that is a 1% methylene blue. Okay. Questions number 26. Phenothiazine, when weight is oxidized and metabolized to options A, leothionol, options B, cysteine, option C, glucosamine, options D, none. The right answer is options A, that is a leothionol. Okay. Phenothiazines, when weight is oxidized and metabolized to leothionol. Okay. Phenothiazines are those drugs which are used to treat a serious mental and emotional disorder including schizophrenia and other psychotic disorder. Okay. Questions number 27. Toxic principle of rosary peg is options A, abrine, options B, ratine, options C, ricin, options D, none. The right answer is options A, that is the abrine. Okay. Toxic principle of rosary peg is abrine. Okay. While ricin is the toxin which is mainly found in castor bean. Okay. Uh, Here are some that plant toxicity along with their antidote. Then, in case of cyanogenic plants, their antidote is sodium nitrite and sodium thiosulfate. In case of oxalate, that's a lime water or dica or phosphates. Okay. Nitrate nitrite, that's methylene blue. Abrus poisoning, that is anti-abrin serum. Carner, that is atropine sulfate or antihistamine. Castor, that's a ricin anti-serum. Sweet clover, that's vitamin K. Questions number 28. Which of the following is the most important mean by which drug enter the body and are distributed across cell boundary? Options A filtration, options B diffusion, option C active transport, options D all. The right answer is option B, that is diffusion. Okay. Diffusion is the most important mean by which that drugs enter the body and are distributed across the cell boundary. Drugs mainly unionized forms is absorbable form, while that passes through that cell membrane, while ionized form is that excretable form. Okay. Let's see some fact related to that active transports. We all know that active transport utilize a carrier substance. It also required energy expenditure too. It's mainly for those drugs whose transportation is against that concentration gradient. Questions number 29. The log dose response curve of agonist given alone and when that's given with that antagonist are parallel in case of when the drug antagonism is competitive. Option B, when the drug antagonism is non-competitive. Option C, when the drug antagonism is physiological, or option D, none. The right answer is option A. That is when the drug antagonism is competitive. Okay. The dose response curve of agonist when given alone and that given with that antagonist are parallel when the drug antagonism is competitive, while the curve is below the agonist given alone curve when the drug antagonism is non-competitive. Questions number 30. In the mechanism of acquired drug resistance, a phage is involved in options A mutations, options B transformation, option C transduction, option D conjugations. The right answer is option C, that is a transduction. Okay. Uh, Here different form of that acquired drug resistance mechanisms, that transductions which mainly involve phage which can transfer DNA from one bacterium to another. Second is this transformations. When the bacterial cells die, they frequently lyse. Their intracellular contain that release, including that fragment of DNA to the environment, and these fragments can be taken up and incorporated into that chromosomes of a living bacterium to provide the recipients with a new characteristic. Okay. While conjugations process involve that transfers that resistance gene or DNA fragment to the another bacterium via that conjugation tube, while mutations involve that the transfer of that that disease resistance acquired that mutated gene to that another bacteria. Okay, okay, this much for today. Thank you.